How to prevent hepatitis B? Safeguarding your liver, a comprehensive strategies for hepatitis B prevention. Good morning, good afternoon, good evening. Thank you for joining us today. My name is Florence. I am a public health specialist, and I am here to talk about a critical public health issue that often goes unnoticed. That is hepatitis B. My presentation today is titled Safeguarding Your Liver, and these are comprehensive strategies for hepatitis B prevention. And our goal is to empower each of you with the knowledge and tools to protect yourselves and your loved ones from this preventable disease. The silent threat. Hepatitis B is a viral infection that primarily targets the liver, a vital organ responsible for countless bodily functions. It is caused by the hepatitis B virus, or HBV. What makes hepatitis B particularly insidious is its ability to be a silent threat. Many people infected with hepatitis B virus, especially adults, experience no symptoms in the early stages. This means they can be unknowingly living with the virus and unfortunately can transmit it to others. The infection can manifest in two forms: acute, which is a short-term illness lasting less than 6 months, and chronic, which means the illness persists for longer than 6 months, often for a lifetime. It is the chronic form, chronic hepatitis B, that poses the most significant danger. Chronic hepatitis B can lead to severe and life-threatening complications, including cirrhosis, which is scarring of the liver, liver failure, and tragically, liver cancer. In fact, according to the World Health Organization Global Hepatitis B Report 2024, hepatitis B was responsible for a staggering 83% of all viral hepatitis-related deaths in 2022. This underscores the urgency of understanding and preventing this disease. A global challenge, a preventable future. While hepatitis B is a global challenge, it is crucial to remember that it is largely preventable. Let's look at the scale of this challenge. Globally, an estimated 254 million people are currently living with chronic hepatitis B. This is a massive number, representing a significant public health burden worldwide. Despite ongoing prevention efforts, the World Health Organization Global Hepatitis B Report 2024 reveals that 2.2 million new viral hepatitis infections occurred in 2022. While this is a slight decrease from 2.5 million in 2019, it still means that approximately 6,000 people are getting infected every single day. The mortality figures are equally stark. 1.3 million people died from viral hepatitis in 2022, and which is an increase from 1.1 million people in 2019. This translates to about 3,500 deaths daily from the viral hepatitis, with hepatitis virus being the leading cause. However, there is a beacon of hope. The World Health Organization has set an ambitious but achievable goal to eliminate viral hepatitis by 2030. Achieving this target could lead to incredible outcomes, saving 2.85 million lives and preventing 9.5 million new infections and 2.1 million cancer cases. This ambitious goal hinges on one key factor, that is effective prevention. By focusing on prevention, we can significantly reduce the global burden of hepatitis B and move forward to a healthier future for everyone. Here are the preventive pillars. Pillar number 1, vaccination, your primary shield. The cornerstone of hepatitis B prevention is vaccination. It is explicitly the safest and most effective way to protect yourself. The hepatitis B vaccine offers nearly 100% protection against the virus and provides a long-lasting immunity, often 20 years or even longer, as highlighted by the Center for Disease Control and Medical News Today. So, who should get vaccinated? The latest recommendations from the CDC, updated as recently as January 2025, are comprehensive. 1. All infants. The birth dose is critically important, ideally administered within 24 hours of birth. Another one is all children and adolescents. Anyone younger than 19 who has not been vaccinated should receive it. Adults aged 19 to 20 to 59 years. This is a universal recommendation, regardless of individual risk factors. And then adults aged 60 years and older. Vaccination here is recommended if they have risk factors for hepatitis B, or even if they don't have non-risk factors but are seeking protection. They should be vaccinated. The vaccine is typically given as a series of 2 or 3 shots, depending on the specific vaccine brand. It is vital to complete the entire series to ensure full protection. Rest assured, hepatitis B vaccines are incredibly safe, with the most common side effect being mild soreness at the injection site. For most healthy individuals, booster doses are generally not necessary after completing the primary series. Pillar number 2, preventing transmission through safe practices. While vaccination is our primary shield, it is equally important to understand and practice safe habits to prevent transmission. Hepatitis B spreads through contact with infected blood, semen, and other body fluids. It is crucial to clarify that it is not spread through casual contact like kissing, hugging, sharing food or utensils, or breastfeeding. Here are key safe practices. 1. Safe sex practices. If you are sexually active, consider consistent and correct use of condoms is essential. Limiting the number of sexual partners also reduces exposure risk. It is also wise to ensure your sexual partners are tested and vaccinated. Number 2, avoid sharing personal items. Never share items that might come into contact with blood, such as razors, toothbrushes, nail clippers, or glucose monitors. Even microscopic amounts of blood can transmit the virus. Another thing is needle safety. This is crucial. Never, under any circumstances, share needles, syringes, or any other drug injection equipment. If you or someone you know uses intravenous drugs, utilizing clean needle and syringe programs is a vital harm reduction strategy. Another one is blood safety in healthcare settings. Rest assured that medical professionals follow strict infection control practices. Blood and blood products are rigorously screened for HBV. However, it is always good to be aware and ensure you seek care from reputable facilities. Another one is safe piercing and tattooing. If you are considering piercing or tattoos, always choose licensed and reputable establishments that use sterile, single-use equipment. Another one is managing cuts and sores. Always consider any open wounds or cuts to prevent and always cover any open wounds or cuts to prevent potential exposure to or from infected blood. Another thing is hand hygiene. Thoroughly wash your hands with soap and water after any contact with blood or body fluid. And cleaning blood spills. In case of blood spills, always use gloves and clean the area with a diluted bleach solution, typically 1 part bleach to 9 parts water. Pillar number 3 is special consideration and screening. Certain populations require special attention for hepatitis B prevention and early detection. One of the most critical areas is preventing mother-to-child transmission. All pregnant women should be screened for hepatitis B as a routine part of their prenatal care. If a pregnant woman tests positive for hepatitis B virus, her baby must receive both the hepatitis B vaccine and hepatitis B immunoglobulin shortly after birth, ideally within 24 hours. This combination is highly effective in preventing the baby to becoming infected. After the vaccine series is complete, typically around 9 to 12 months, the baby will need post-vaccination serologic testing to confirm the vaccine's effectiveness. The World Health Organization's 2024 guidelines also expand eligibility for antiviral prophylaxis for pregnant women to further prevent mother-to-child transmission. So beyond mother-to-child transmission, it is important that household contacts and sexual partners of hepatitis B virus infected persons are also tested and vaccinated. Healthcare workers, due to their exposure risk, should also be vaccinated and consistently followed, and they have to follow universal precautions. Generally, screening is also vital. The Center for Disease Control recommends that all adults aged 18 years and older be tested for hepatitis B at least once in their lifetime. This involves a triple panel blood test that checks for hepatitis B surface antigen, antibody to hepatitis B surface antigen, and total antibody to hepatitis B score antigen. Knowing your status is the first step towards protection or management. Finally, if you are planning to travel, especially to areas with a high prevalence of hepatitis B, ensure you are up to date on your hepatitis B vaccination. Looking at the latest advancements and future outlook, the fight against hepatitis B is consistently evolving, with exciting advancements in prevention and management. In the vaccine technology, newer vaccines, which has received approvals in the United States, European Union, and Canada, are showing superior seroprotection rates compared to the standard vaccines, achieving up to 99.3% after the third dose compared to 95% with older formulations. Researchers are also exploring single administration vaccines and alternative delivery routes such as oral or pulmonary vaccines to improve compliance and accessibility, especially in resource-limited settings. Beyond preventive vaccine, there is significant research into therapeutic hepatitis B virus vaccines, such as Thavac-B. This aims to overcome the immune tolerance often seen in chronic infections and help the body clear the virus. Diagnostic improvements are also key, with the World Health Organization's 2024 guidelines emphasizing point-of-care hepatitis B virus DNA viral load testing and reflex testing to streamline diagnosis. We are also seeing the emergence of test and treat concepts, which aim to streamline the care process from hepatitis B and even hepatitis D, and as highlighted by recent studies in July 2025. And in a fascinating development, artificial intelligence, or AI, is being leveraged to predict the immunogenicity of vaccine candidates, accelerating the development of even more effective solutions. In summary, the key takeaways for actions are: let's bring it all together. The message is clear. Hepatitis B is preventable, and you have a crucial role to play. And here are your key takeaways for action. Number 1, vaccination is paramount. Make sure you, your children, your loved ones are vaccinated according to the latest recommendations. It is your strongest defense. Number 2, practice safe habits. Be mindful of how the virus spreads and consistently adopt safe practices in your daily life, especially regarding sexual health and avoiding the sharing of personal items or needles. Number 3, get tested. Know your hepatitis B status. If you have risk factors or are pregnant, screening is essential for early detection and intervention. Number 3, educate others. Share this viral information with your family, friends, and community. Awareness is a powerful tool in prevention. Number 5, support public health initiatives. Advocate for and participate in public health campaigns that aim to increase access to vaccination, screening, and treatment services in your community and globally. Towards a hepatitis B-free future. In conclusion, hepatitis B presents a serious global health challenge, but the good news is that its elimination is within our reach. Continued progress relies on universal vaccination, early diagnosis, and effective management strategies. By understanding the risks and consistently implementing these preventive measures, we can significantly reduce the burden of hepatitis B worldwide. Let us work together as individuals and as a global community to make hepatitis B a disease of the past and build a healthier tomorrow for everyone. Thank you. I am happy to take any question you may have. And for more information, please refer to these reliable resources: the World Health Organization, the Centers for Disease Control and Prevention, and Hepatitis B Foundation, and your local Ministry of Health or Public Health Authority. These organizations provide accurate and up-to-date information on hepatitis B.